Hi, I'm Dr. Nixon with Healing Peak Regenerative Medicine, and today I wanted to take the time to tell you about me a little bit and how I look at my patients and how I assess pain, and why it's really important to have someone like me on your healthcare team or a medical naturopathic doctor. Not all the naturopaths out there in the world are calling themselves naturopaths have a medical degree. They're not all actually doctors, and they don't all have the type of schooling that a naturopathic doctor has. And I just want to shed a little light on that. People who call themselves health coaches, those people also don't have a medical degree, and so it's really important to get information from someone who has an actual medical degree or an actual license and has had extensive training in this area, or you could end up someplace you don't want to be with your healthcare because they may not know how some supplements interact with your medications and things like that. So I'm going to walk through, my credentialing and then how I look at patients. And when a patient comes in the door, what makes me different? How come I can get to the root of their pain and where it's all coming from, or their problems, and other health coaches or people who claim to be naturopaths but aren't actually doctors can't. And actually, in some cases, it's just the way that I've seen patients for a long time. So I have a 4-year naturopathic medical degree in naturopathic medicine, meaning I've taken board exams and passed those exams in order to become a medical naturopathic doctor. And that's very similar to a medical degree, a conventional medical degree. We take the same basic science boards as an MD. And then where the difference starts to change is in our treatment options, where medical doctors really learn how to address conditions with pharmaceuticals. Naturopathic doctors learn how to address conditions with supplements, vitamins, micronutrients, diet, exercise, and herbs. And so we take extensive courses in botanical medicine, meaning the biochemistry of herbs and how they react in the body like medicine, and how food reacts in the body like medicine. And then there's also other parts of naturopathic medicine, such as hydrotherapy, which is therapy of cold and hot water on the body, and how does that affect health, or how does that stimulate our immune function. Naturopathic doctors are also allowed to adjust patients like chiropractors, so we get extensive classes in how to adjust patients. I don't use that modality, and I don't use a lot of hydrotherapy either, but some naturopathic doctors do, and this is all part of our scope. And when we look at a toolbox of all our treatment options, these are there, and we're taught about them. So even if I'm not going to do something that I think a patient needs, like hydrotherapy, I can refer them out to do that because I think that that's the therapy they need. And so that's a really good reason to see a naturopath, is because even if that one can't help you, they may know of a modality that can. And that medical degree is really imperative, because while we're learning about those botanical herbs and how they react in the body, and we're learning about supplements and how they react in the body, we are also learning about how these things react with medications in the body. What things are contraindicated, what things are not contraindicated, meaning you can or cannot take them with your medications, which is really important, especially in the United States, when 9 out of 10 patients are taking some form of medication. And you really want to know, like, are your supplements going to interact with that? Because if so, like, you could be putting yourself in a dangerous spot and not even realize it. And so I just wanted to kind of talk about that. So I have a naturopathic medical degree. It was a 4-year degree. I had to take board exams to become a naturopathic doctor. And I also have a master's in acupuncture. I have a certificate in Chinese herbal medicine, and my bachelor's of science is in nutrition and foods. All of these different types of education have given me a very unique perspective on health and the body and how it heals and what to do to help it heal permanently, so that that person, if coming in contact with things that are going to affect their immune function or decrease joint function, I can, increase pain, whatever their condition may be, I can look at that and say, okay, what do we need to do to get this to actually heal up long term? What's a real solution? And then if that starts to come back because the person has kind of slid off on their diet and lifestyle, or they've had a bad year or whatever, they kind of know at that point what to do to get themselves back on track. And so it's always my goal to educate my patients so that they know how to heal themselves, right? And that they know where to go if it's not working for them. And so I just wanted to address that because there's so much out there on the internet, fabricated fame, left and right, people with 10,000 followers, and that's really believable, right? But they may not have the schooling that they need to in order to be really safe practitioners. And it's a big deal right now because everything's becoming so much more internet based, and it's fairly easy to pay for a bunch of stuff that gets you reviews and gets you all these things that may not actually be true, authentic reality of seeing lots of patients or whatever. It's fabricated fame, basically. So I encourage you to see someone. If you're looking at, starting a nutrition program or you're starting a health program, please make sure that that person has been adequately trained in whatever they're doing, and really be skeptical if there's no degree or certification of some kind, legitimate certification, okay? So when a patient comes in, it's really important to me to find the pain generator. And to me, that means what is causing the pain? Is it inside the body? Is it is it systemic? Is it something that's happening like diabetes or hypothyroidism, like I talked about in my last video? What's causing the pain? What is the pain generator? If it's something that's circulating through the whole body, meaning systemic, that needs to be addressed first, because if it's not, then that person will never get better with acupuncture, injections, regenerative medicine, any of those things. So first and foremost, we are looking for systemic contributors and then dealing with those. And once we've dealt with those systemic contributors of pain, usually pain comes down either entirely to 100% or it comes down maybe 50%. It depends on the person. And that can be from hormone balance, it can be from diabetes, it can be from hypothyroidism, it can be from food allergies and food sensitivities, it can be from a lot of different places. And that's my job, to screen the patient, ask the right questions, get the right information so then I can let them know where most likely that's coming from. We treat that. If the pain is not gone, then we can look at trigger point injections, which are an intramuscular injection that help relax tense muscles, and it works so well. It is so effective for decreasing tension. And if you come in and you're already kind of on that naturopathic plan and you're kind of know what things to eat and you're feeling good otherwise, we go straight for the injections because I know they're going to work in you. But if I see a lot of reasons to say, hey, I don't think your body's functioning as well as it should, like, you could probably clear this up by doing this, this, and this, and we don't need to use injections. I'm going to say that, right? Injections are very, very, very effective and handy in the right patient. And sometimes we do them first and foremost, and sometimes we don't. It just really depends on the health of the patient and the vitality I see when they're coming in the door. And then the other thing that we can do is prolotherapy. It's a high dextrose concentration solution, and we inject that into the joint, and it initiates an acute healing response, giving that joint an opportunity to heal again. And that's great for tendonitis, golfer's elbow, tennis elbow, shoulder problems, shoulder pain, mild arthritis helps a ton, low back pain. Prolotherapy is excellent for joint problems. And so you've got trigger point that's for muscular issues, and prolotherapy is a regenerative injection. It grows cartilage back, it shuts tendonitis down, and it's really a beautiful restabilizer of a joint. It works exponentially well for joint pain and joint instability. And then the highest intervention treatment that I offer is PRP. It's platelet-rich plasma. So that is, we draw your blood, we spin it down in a special centrifuge, we pull out the active ingredients, which is the PRP, platelet-rich plasma, and we inject that back into the joint. The technique is the same as the prolotherapy. It's just a more inflammatory, purposefully inflammatory injection, and that really works in moderate to severe arthritis or partial to, not full, but partial to severe ruptures of tendons. Like if you have a rotator cuff tear and you're not a surgical candidate, PRP will fix that. And labral tears in the shoulder or labral tears in the hip are really, really great injuries for PRP, and then you don't need surgery. They're also excellent if you catch arthritis early and you start doing PRP. You can prevent joint replacement entirely. And so if the joint's not in pain, why do you need joint replacement? Even if you're bone-on-bone arthritis, you know what I'm saying? And so it's really important, one, to get the body into a really nice healing state, a really nice anti-inflammatory state, and then use these injection therapies to further improve any other deficits that are happening that need to either restabilize or we need to grow cartilage back. And so that's just an overview of what happens when a patient comes in my office, and how do I look at them holistically and say, okay, the pain is probably coming from these three things, and let's address them all and one at a time, or sometimes together, depending on, again, the vitality and health of the patient, if they can tolerate more than one thing at a time. And then they're better and they leave the office, right? And they come back if they injure themselves doing something weekend warrior, right? I mean, my patients are typically people who really want to be active and don't want to slow down their lives for things that really make them happy. You know, if they're slowed down by things that make them happy, that's usually when someone's going to call my office and say, hey, I really need to get this thing taken care of. And I really enjoy doing that. It's a really rewarding thing to do with my life, and I am happy to offer it to anyone who, you know, wants to get down on the ground with their grandkids. But my one word to all of you is, word of advice is, if you're going to seek out a naturopathic doctor, especially for pain or any condition really, make sure that they have, you know, the credentialing necessary to give you a proper diagnosis, to find the actual solution to the problem, and that they're highly educated and have a process in addressing your situation and know, you know, what's going to conflict with your medications and things like that. And don't necessarily buy into a really expensive program with a health coach that doesn't have that type of education or credentialing, because it's, you know, it may land you someplace you don't want to be. And so I just wanted to address that today and kind of give you guys the background on me and my education and how I look at my patients. I can treat patients virtually or give suggestions virtually in other states. So if you know people that you think may benefit from having naturopathic care, but they don't live in Washington State, which is where my practice is, in South Seattle, then I'm happy to do a virtual consult with them. And our office phone number is 206-899-6000. You can also schedule an online appointment at healingpeak.com or follow me on Instagram at Dr. Amber Nixon. There's a lot of really good content on there as well. Thanks for watching. Have a great day.